Hospital. We also have Dr. Renuka Prasad, Secretary, Indian Cancer Society. And we have Mr. Vicky Nanda, COO, Niramay Health Analytics. I would like to thank our speakers to be here, and I invite them to start the session.
Good morning to all of you. The title of this session is Driving AI Impact Through Real-World Action, which came about as a concept during the NXT conference last year and turned into something called the Namo Shakti Rath mission, which is now achieved the status of one of the largest actually, breast cancer screening program in the world. So I'll just start off with saying, good morning to all of you. When we speak about artificial intelligence today, the conversation is often about disruption, scale, valuation, and speed. But here is the real test of innovation. Does it stay inside the conference halls, or does it actually step out and affect people's lives, touch it intrinsically? The NXT conclave was born out of the very question. It was not designed to be another summit of speeches or an applause. It was created as a platform to discuss, track, and implement ideas that create measurable long-term impact. When we conceptualized NXT, the intention was simple: bring policymakers, scientists, entrepreneurs, and industry leaders into one room, not to exchange visiting cards, but to exchange responsibility, not to admire technology, but to deploy it. On the 1st of March 2025, at Bharat Mandapam, right here where we stand, experts demonstrated AI-enabled breast cancer detection technologies. For many in the audience, it was a breakthrough device. For me, it was a moment of clarity, personally. I must share this before I speak any further, because this is something which was very emotionally attached to me. My elder sister, for about 16 years ago, who herself was a doctor, was diagnosed with breast cancer in the 3rd stage. And this is while she was working at Johns Hopkins. And in spite of the fact that she was a doctor, she had problems in knowing that she was plagued with this problem, with this disease. So in this technology exists, why should it remain confined to hospitals in metropolitan cities? Why should awareness, access, and affordability decide survival? Because in India, the breast cancer is not only a medical challenge, it's also social silence. According to the Indian Council of Medical Research, breast cancer accounts for nearly 28% of all cancers in women in India today. And the Globocan estimates more than 2.3 lakh new cases annually, which also results into about 90,000 deaths every year. Every 6 minutes a woman is diagnosed. Every 10 minutes a life is lost. Most cases are detected late, in advanced stages. Survival rates decline, not because science is weak, but because access is delayed. At NXT, we did not want innovation to end with applause. We wanted to travel. That is how Namo Shakti Rath was born. The name Shakti is deeply personal to me, because this is something which I have taken as an inspiration from my mother and all the motherhood that comes with it and the power of women. And the larger vision draws inspiration from our Honorable Prime Minister, who emphasized about preventive healthcare, digital transformation, and last mile delivery that has shaped India so far and will become the bedrock of a foundation of a developed India by 2047. So if we want to be a developed country, we have to have an ecosystem which is conducive for healthcare sector, and especially for the people who need it the most. And that's exactly what the Namo Shakti Rath represents, a confluence of personal conviction and national vision. We chose an AI-enabled, non-invasive, radiation-free screening technology, which is no touch, no exposure, no radiation. It uses thermal imaging integrated with AI-based pattern recognition and automated cloud analysis to generate instant digital reports. It preserves the dignity of women, it respects privacy, but the real innovation is not the device, it is the delivery model. On 17th September, this initiative and the Rath was flagged off in Haryana. On 14th January, it was launched in Varanasi. Today, more than 30,000 screenings have been conducted in Varanasi and Ambala alone. multiple vans. We have about more than 42 of these mobile vans which are operating on a daily basis with a dedicated team, with digital dashboards which track the progress in real time on case-to-case basis. Every participant is registered through secure digital systems. Each screening generates a unique ID, geotagging locations, technician authentication, and encrypted AI reports. This is structured, this is accountable, and it is scalable. This is the AI translated into public health architecture. When a mobile van enters neighborhood, it does more than conduct screening. It breaks stigma, it normalizes conversation, it tells women that early detection is strength and not fear. Earlier, healthcare waited in buildings. Today, healthcare moves on wheels. That is what driving AI impact through real-world action truly means. NXT proved that a conclave can be more than a discussion. It can be a catalyst. It can track ideas beyond the stage. It can convert dialogue into deployment. Artificial intelligence must not remain a lab achievement. It must become a humanitarian instrument. A developed nation is not defined only by GDP growth or digital exports. It is defined by whether its mothers and daughters survive preventable diseases. For me, Shakti is not just a word. It's my mother's blessings. It is every woman's strength. It is the moral force behind this mission. When history looks back at this era, it will not remember how advanced our algorithms were. It will remember whether technology stood with humanity. Namo Shakti Rath is not just a vehicle, it's a moving light, and that light carries dignity, assurance, and hope. I just want to share a few personal instances with you before we start the panel. You know, it was a really heartwarming and a satisfying feeling when you attend these camps, because when people from all walks of life come, I don't think the people working on the project, on the technology, on the quantum aspect or the AI aspect of it would have ever thought that what they are working on will have such a great social impact on Asha Rani in Ambala or Fulo Devi in Varanasi, in terms of what difference it can make. The problem is of awareness as well as the social stigma that remains. While we were curating the technologies, we looked at the Indian problems, the problems that we face in the Indian mindset, which was definitely a big advantage that there was no radiation in this technology, but also the social stigma that came in some parts of rural India was also to be addressed because it was non-touch, non-invasive, and no pain. These are parameters which have helped us expand a campaign and take it to the furthest parts of the country, and which we are expanding on now and taking it to the next level where we are doubling the number of centers. Not only does it provide an alternative to this first step of screening, which is the first point of contact, but also reduces the load on the entire healthcare system to be able to filter in and funnel those cases which have been defined because of the rates of efficacy and specificity, which is about 95% through this technology. So I will not take more time. I will just ask the panel to start the conversation so we can have a dialogue which is more relevant and related to the issue at hand. Thank you very much. So I'm going to start off with Mr. Vicky from Nirmay. I think he will set the ball rolling if he can put the context as the technology and the thought process behind it, and then we can take it one by one to all our esteemed panelists on the...
Sure. Thank you so much, Sri Kartikeya sir. I will be quickly talking about Niramai and our technology. Just to give a full background, Niramai is the startup based out of Bangalore. It's an AI medical device company. We have built a device called Thermalytics. Niramai is an ISO certified company, ISO 13485, ISO 27001. Thermalytics, which is the main product, is actually being built for breast cancer detection. Thermalytics is registered with CDSCO. This is completely Make in India product, which is very important to talk about it. It's obviously an AI product. And then Thermalytics is also, CE mark approved. The other product which we have for breast cancer is Smile 100, and Smile 100 is US FDA cleared. So we are among one of the pioneers when it comes to AI, having built a device, getting both CE as well as US FDA clearance apart from CDSCO clearance in India. So sir was talking about, Sri Kartikeya sir was talking about, some of the macro, and we were also looking at this, late detection. One of the primary factors is access to screening, as he said, rightly said. Just to give some more numbers to it, while 28% is the incidence rate, which he highlighted, but the screening rates in India is less than 1%. So you look at women population and you look at the screening numbers in India. So what it means is definitely India needs more innovative technologies to fill that gap. So the current existing technologies are able to reach only 1% of the population. Now with this innovation, with this campaign which sir explained, I think there is a huge potential to reach this to every woman, right? So that is where we are thinking from Thermalytics perspective. And just to little bit double dive, click on the product. So the product is absolutely non-invasive. There is no touch involved to the woman. Just imagine a screening room area which is built privately for the woman. Woman enters into it and closes a room. And she is alone inside in front of the thermal imager. And she sits there for 2 minutes. A thermal image is taken which is below the neck and above the abdomen. And that's it. And she comes out, and then her job is over and the report is ready by the time she comes out. So it is as simple as that. Nobody has seen her, nobody has touched her, no radiations at all, and then the report is ready. It is that kind of process that we are talking about. So that's quickly, briefly about the product.
I wanted to ask you, how is it that the Indian, being an Indian company, which is part of Make in India, and how have you taken the sensibility of the Indian context into account, which has been helpful in this campaign? I want your perspective.
Definitely, the perspective is that this no touch is definitely one of the important, aspect. Even if we look at, existing methods, which is clinical breast examination, which is a hand-based examination, which involves touch, and maybe some of the other technologies, which are mammograms, which requires, compression, and it is also restricted to, few hospitals or large hospitals. So access becomes an issue. So in the Indian context, this portable device can be taken to gullies and mohallas and really deep into the communities. And women are, educated through the programs like this, like you spoke about, Namo Shakti, Rad, where the education is provided that there is a non-touch, non-invasive, radiation-free drive is going on. So a lot of advocacy happens through, through this program. And then once women are convinced, they come forward automatically. And we have been seeing, crowds every day in this program because they themselves experience it. Because we believe ASHA workers are the real threats to the to the communities. They can really go deep into the communities.
Anganwadi workers, the ASHA workers.
Anganwadi workers, ANMs, they can connect with communities faster. And once they are educated about this device, it is that simple, non-invasive. They quickly talk more in the community to bring them people.
Yeah. Can I just butt in here a little and to tell you about us at the Indian Cancer Society, where generally it is comprised of volunteers. It's the largest volunteer-based organization. And most of the people who are there working as volunteers, had they themselves been through the process of going through breast cancer or any one of the other cancers. And if they haven't gone through it, well, they have nurtured someone and cared as a caregiver for that individual. So they are very familiar with it. And since the force is comprising of such people who have experienced it and gone through it all, they are made aware of the things by a personal experience right there itself. For example, there's me myself here. I was able to detect my own cancer through a breast self-examination, which I had been hearing people talk about a breast examination. And it was not taught to me by anyone, but I had just read it and heard about it. And lo and behold, I found my own cancer, and it was in the first stage. Now, with this particular device, it is very difficult to check it out in the first stage itself, because a mammogram at least gives you that, that precise thing that, yes, in a way precise, at least 90% precise, that yes, there is a probability of a nodule having developed there, which can be further investigated. But this, so you're groping in the dark for quite a fair time before the lady is actually diagnosed. But yes, what is a good point of this is that it can be done in masses, unlike mammograms, which cannot be done. You know, it's a limited number that can be done. So when you're doing screening on a mass scale, I suppose this is the best way to do it.
Dr. Mandeep, would you like to come in?
First of all, I want to congratulate you. I want to congratulate my Prime Minister. इंडिया का प्रॉब्लम है, इंडिया का सॉल्यूशन है. सबसे बड़ी बात ये है. देखिए, सबसे बड़ी बात ये होती है कि हम ब्रेस्ट कैंसर हमारा सबसे बड़ा कैंसर है. मुझे अर्ली डिटेक्ट क्यों करना है? मुझे अर्ली डिटेक्ट करना है क्योंकि मेरी लाइफ बचानी है. If I have a stage 1, stage 0, my survival is 80 to 90%. If I have a stage 3, stage 4, my survival goes down. Stage 3, 50%, stage 4, we all know that. Secondly, if I have a stage 0, stage 1, I just need to do surgery. That said, 50% of it will take hormone tablets. I don't need chemotherapy because 50% of Indian population is hormone receptor positive. Thirdly, if I have an advanced stage, I would be looking at neoadjuvant chemotherapies, immunotherapy, targeted therapy. Look at the resource which I need to put in for treating such patients. Second, lastly, what I want to say is when I say early stage detection, none of my patients at early stage will lose their breast. That is another big thing. And now coming to the Indian population. Indian breast cancer is not what the American breast cancer is. What you have a solution in America is not what will work here. Mammogram does not work in India, period. The problem is that India, the mean age of incidence of breast cancer in India is 45. When I'm sitting in Delhi, 45 is the mean age of incidence when a woman gets breast cancer. When I'm going to Northeast, that mean age goes down to 35 years. And what is mammogram? Mammogram is X-ray of breast. Why we say that we have to do it at 45 years plus? Because 40, 35, it doesn't work. Why it doesn't work? Because when we have younger females, we have density. The breast density is high. Why? Because milk ductal tissue is high. And when you achieve 45 plus, it's menopause. Milk density goes down. That is when mammogram is effective. So that is the data behind why mammogram is effective in America or UK, because their mean age of incidence is 60 years, 55 years. So that solution will not work in India. This is proven by studies from Tata Memorial. This is proven by studies from SGPCI. Now when I have a woman at 45, what I'm looking at, what is my solution? My solution comes self-breast. My solution comes clinical breast. But more than that, where does Niramaya comes into the picture? It is a thermal image. Now thermal image will detect a neoplastic change or cancerous change. वो जब कैंसर जैसी चीज बढ़ने लगती है तो हीट बढ़ेगी, angiogenesis बढ़ेगा. That is where the thermal image will come into the picture. So thermal image becomes a solution to the Indian problem. It's not that the next part is कि अगर मैंने mammogram कर भी लिया, now I go to a place, I get a mammogram done. I get 100 mammograms done. The problem with that 100 mammograms is that when somebody reads those mammograms, so I need a competent radiologist to read that mammogram. So this is where I think they provide the solution. We are basically supplementing the radiologist with AI. So the best part of Niramaya and AI solution is negative predictive value. I am not looking at positive predictive value. Negative predictive, मैंने 100 लोगों का निरामया किया, मैंने उनमें से 70% नेगेटिव कर दिए. उनको नहीं है कैंसर, वो घर जाएं. बचे 30. अगर 45 से ज़्यादा है, मैं मैमोग्राम अल्ट्रासाउंड करूँगा. 45 से नीचे मैं सिर्फ अल्ट्रासाउंड करूँगा. उस अल्ट्रासाउंड में से मैं वो 5 पकड़ लूँगा जो अर्ली स्टेज पे होंगे. अगर मैं ये नहीं यूज़ करता हूँ, तो मुझे वो 100 का मैमोग्राम, 100 का अल्ट्रासाउंड करना पड़ेगा. फिर मैं मैमोग्राम भी करूँगा, मैं एक रेडियोलॉजिस्ट को भी एम्प्लॉय करूँगा. तो हाउ मच रिसोर्स, हमारे पास ये रिसोर्सेज नहीं है. अभी तक हम इंडिया में जो हम मैमोग्राम्स कर रहे हैं, वो हम डायग्नोस्टिक मैमोग्राम कर रहे हैं. डायग्नोस्टिक मैमोग्राम का मतलब ये है कि अगर हम कैंप जाते हैं, 90% क्या होता है, अगर कोई लंप है या कुछ है तो इवैल्यूएशन के लिए कर रहे हैं. वो अपनी जगह है. हम इंडिया में उस स्टेज पे नहीं पहुँचे हैं कि मैं स्क्रीनिंग मैमोग्राफी की तरफ आ जाऊँ. स्क्रीनिंग मैमोग्राफी के लिए Renuka ji, unki organizations, they put in lot of CSRs and they make awareness and everything. So effort बहुत ज़्यादा है screening mammography का. Whereas effort for Niramya is lesser. Secondly, it मेरी population at large को पकड़ेगा. मेरे को 30 years पे जो breast cancer हो रहा है उसको भी पकड़ना है. मेरे को 25 years पे भी जो हो रहा है उसको भी पकड़ना है. और मेरे को 60 years पे भी हो रहा है उसको भी पकड़ना है. और more important is आप ये चीज़ समझो कि एक 45-year-old जब हमारी peak age of incidence of breast cancer है इंडिया में अगर लेडी को ब्रेस्ट कैंसर होता है एक वुमेन को तो पूरे 3 जनरेशन हिलते हैं. अगर इंडिया में मेल वर्किंग है राइट तो वो पैसा कमाएगा. बट अगर जो लेडी है वो अपने हस्बैंड का भी ध्यान रखेगी, वो अपने बच्चे का भी ध्यान रखेगी, वो अपने सास ससुर या उसका भी ध्यान रखेगी. और उसको कैंसर होता है या वो हिलता है तो पूरी फैमिली टूट जाती है. सो द बेस्ट पार्ट इज ये हमको अमेरिका से नहीं मिलेगा. ये मेरे को एआई कोई यूएस वाला बना के नहीं देगा. मेरे को इंडिया में बनाएंगे. इंडिया का थर्मल इमेज है. थर्मल इमेज बहुत दूर बहुत टाइम से था. यूएस को उसकी वैल्यू ही नहीं थी क्योंकि उसके लिए यूएस थर्मल इमेज उसको लगता है कि नहीं ये मैमोग्राम मेरा सुपीरियर है. अरे यार वो डिबेट सुपीरियरिटी की तो है ही नहीं. डिबेट है एप्लीकेबिलिटी की. मैं इसमें डिबेट ही नहीं करना चाहता कि मैमोग्राम बेटर है, अल्ट्रासाउंड बेटर है, निरामया बेटर है. वो डिबेट नहीं करनी मुझे डिबेट करनी है कि मैं अब अगर मैं मैमोग्राम्स करूंगा तो क्या मैं अपनी जो पीक एज ऑफ इंसिडेंस है उसको मैं पकड़ लूंगा. स्क्रीनिंग का पर्पस ये होता है कि अगर 45 मेरी पीक एज ऑफ इंसिडेंस है मुझे स्क्रीनिंग 10 साल पहले शुरू करनी है. आई नीड टू स्टार्ट एट 35 मैमोग्राम का रूल ही नहीं है. 35 रोल है किसका है? क्या मैं एमआरआई कराऊंगा सबके? बहुत मुश्किल है. अल्ट्रासाउंड कराऊंगा. अल्ट्रासाउंड में मुझे एक रेडियोलॉजिस्ट चाहिए और दूसरी चीज़ वो पूरा ब्रेस्ट देखेगी. So that is why Niramya is a very good solution because this is a thermal image. बहुत टाइम से इंडिया में चीज़ पे काम हो रहा था. इन्होंने वो थर्मल इमेज पकड़ा और थर्मल इमेज पे एआई लगा दिया. तो थर्मल इमेज इंडिया की पॉपुलेशन के लिए बहुत अच्छा है. उसके ऊपर एआई लगा दिया तो रेडियोलॉजिस्ट जो सबसे स्कार्स इन मेडिकल इज अ रेडियोलॉजिस्ट. आपको डॉक्टर मिल जाएगा, फिजिशियन मिल जाएगा, आपको सर्जन मिल जाएगा, ऑर्थोपेडिशियन मिल जाएगा. रेडियोलॉजिस्ट सबसे मुश्किल होता है. एंड रेडियोलॉजी इन and Mr. Kartikeya will agree, is the most coveted branch when I give my postgraduate medical entrance. So सबसे जो topper होगा वो radiologist उठाता है.
I think that's a very valid point, Dr. Mandeep, you've made, and I would want to come to Dr. Sandeep if possible on the same issue.
Yeah, so just I want to add, good morning to everyone present here. So I just want to reiterate the idea that in rural scenario, the situation is very different. First of all, resources are problem, and the biggest problem is the stigma. That Dr. Mandeep told that you tell somebody to palpate or something, वो कहते हैं अभी साइज छोटा है, मेरे घर में तो किसी को कैंसर हुआ ही नहीं, कैसे कैंसर हो सकता है? तो denial, self denial is the biggest problem. And when you reach to the community, you diagnose them, you educate them, and when the people get connected to them, then only they get motivated and they will move forward to the investigation. And I think the best excellent approach with this technique is it is no touch, no see technique. There is no radiation, because the biggest problem is when you ask a patient कि यार आगे further testing कराओ, then they are worried about that they have to go in the big machines where the resources are not available. Secondly, nobody wants to get pricked. And the problem, the rule of thumb, what Dr. Mandeep was telling, that early diagnosis leads to cure. Absolutely. When the disease comes late, then the whole trauma comes. एक lady है वो पूरा घर संभालती. And when
the entire ecosystem
is bigger. And I tell you, when you diagnose a patient and you come to any OPD, ask patient to get vaccinated for cervical vaccine or any vaccine, they will not go for it.
Very hesitant.
And very hesitant for that. And when even if one person is diagnosed in the family, then the whole chain reaction begins and everybody starts looking for that vaccine. So I think this is an excellent idea, and what Namo Shakti Rath is doing, I think it's one of its, I think, brainchild idea, what has brought out. I want to congratulate them, what they have gone through, what they have done to the community. And with this, I think more people will get motivated and more disease will come forward. I deal in tuberculosis and I find out that the stigma, people don't go for simple x-rays. Because वो यार मेरे घर में तो किसी को है नहीं, मेरे को कैसे होगी? So that denial phase is very big problem, and then the people land up in the biggest problem in our country is quacks.
No, absolutely, Doctor. I think that you're absolutely right. And one of the most important things on what ma'am said was, how do you make it into a doorstep screening facility? I don't think it would have ever been possible if such a technology did not exist and if AI was not an enabler in that sense.
Absolutely.
But I want to ask Dr. Aishwarya Pandit, who's running the ITV Foundation, what were the social aspects of this campaign that you had to deal with? And when you went on the ground and you basically interacted with the people, with the Anganwadi workers, the Asha workers, who are the accentuators of this program, who actually make it happen on the ground, who mobilize the people, the resources. What is your interaction and takeaway from this entire campaign that you've done?
I think I experience when we are looking at Haryana and we're looking at UP, we were looking at two different socio-economic makeup in terms of the population, and that's what we noticed. In Haryana, when we went, I think what we missed the point is, apart from the screening part, when there is a mobilization by the Anganwadi and Asha workers, they are also raising awareness regarding breast cancer. Because when the people come and ask them, like when the women ask, what do we have to come for the screening for? Like, why do we need to get the screening done? Because then they're telling them that this is early screening for breast cancer. So they are also becoming aware of the fact that we all need to get screened for breast cancer. We have conversation with them. We used to have conversation with them at the camps. When I would go, I would tell them, they would, obviously there was an element of fear while going in for the screening. I would tell them, you get yourself screened, you'll know that are you susceptible or not? Are you having that? And the report will be generated and it will be given to you right away. So a lot of women, after they had got the screening done, they would often ask the technician, what did my results say? And when the results would say that you are more or less in the safer zone, they would feel relaxed. They would encourage more women to come for screening. And the word would spread in the local community that there is a screening happening. Everyone should take advantage to it. Earlier, the older women came to our camps, the age group 55 to 60, who were largely the mother-in-laws who would come. When they were completely satisfied in Haryana, then they would say, we'll send our daughters. We will send our daughter-in-laws, and they would come. They would just not come for the screening. They would come, they would have a look at the camp. They would look at the complete privacy of it. They themselves would be convinced of it. They would go through the whole procedure. Then they themselves would say, so what are the precautions we are supposed to follow? I would tell them, keep doing breast self-examination from time to time. Kahin par bhi aapko gaat lage, to aapko batana hai. So they were like regular, I would say, yeah, from time to time, 3 to 4 months, keep examining your breasts. So it helped raising an awareness regarding a thing. If at the right time they are able to self-examine and get that, then that way they will be able to spread the word among the larger community. Similarly, in Varanasi, what I saw, there women were far more forthcoming because in coming to camps, they were easily mobilized. They would talk about it extensively. The Asha workers would mobilize them one day, but then the next day when the mobile ambulance would go to their location, they would say, you know why we come? बिकॉज हमने अभी रोटी बनाकर हम आए हैं, अभी हमें आधा 1 घंटे का टाइम है, हम अपना स्क्रीनिंग करके वापस हमें बच्चे स्कूल से आ जाएंगे, फिर हमें उनका दोबारा उनको खाना देना है या मेरे हस्बैंड काम से आ जाएंगे उनको खाना देना है. वी हैव टू रियलाइज द रियलिटीज. Women in India also doing a large part.
Dr. Aishwarya, I really want to ask you because see, I've seen multiple, I'll come back to you after this, ma'am. We've seen that there have been multiple initiatives. What does it take to make an initiative successful on ground? You have district administration working, you've got companies like Nirmay working, you've got other people working, volunteers working. It's a confluence of all of them. It's an effort which has to be done in a dogged manner, pursued. Only then can you take it to a culmination point. So what is your experience on that effect, and what would your advice be?
I would say that every day you have to be consistent at it and try to raise more and more awareness at it. We went again and again and again to the mohallas. For the first time, you had a certain section of women coming in who were more proactive regarding their health and more aware. Then you had, in the second round, even more women would come. please understand they have to devote a large part of their daily routine on household work. So we also have to tell women prioritizing your health is a good thing. So this is also telling them to prioritize their health.
What about you, ma'am? What do you
Well-
say about the volunteers and the social involvement of such campaigns? Because these campaigns can't be successful, or it's not just the government's job to do it. It is
Definitely,
civil
it's
society
got
and
to-
everyone coming together.
Absolutely. It is the civil society's job to see that these kind of things are taken care of, and especially healthcare. I mean, it is, and cancer these days is definitely on the rise. We are all reading about it day in and day out. So for us, it's not only the breast cancer that we are looking at. We look at all cancers in a holistic manner. We do it for men, for women also, both. So both come to our camps, and for us, like I told you, we motivate them through our awareness talks. These awareness talks are done at the community level. They're done at every level. It could be a resident welfare association. It could be just the areas, the Anganwadi ladies help us to organize such camps. There are other organizations that invite us to come in and give talks. So you sensitize the people and get them to come in, because stigma, of course, is a very, very big thing. But that gets removed away from the fact when they hear that you yourself have been through it. You know, and when somebody says that I've been through it, and it's kind of a shock for them to say, कि अरे आप भी इस दौरान से गुजरी हैं. They just can't believe it. And, that's why I think they started addressing us as doctors over a period of time, when none of us are actually doctors. It's just that we've had this training on the job. And that's how many of us are called as doctors. Like today also, I think it's written somewhere as Dr. Renuka Prasad, but I'm just a plain volunteer who has been through it and survived for nearly 30 years.
Let me ask next question to the actual doctor. Dr. Mandeep, if I may ask that in a country like India, we have a very diverse set of problems. We have different segments of people. A lot of people in the urban centers can afford healthcare and medicine. A lot of people in rural parts of the country can't afford healthcare. And, so what do you say when the world's largest healthcare program like the Ayushman Bharat has been launched by the Honorable Prime Minister of India, which ensures 5 lakh rupees of insurance to every household, and about 11 crore people have already availed the benefit. What does it do for something like breast cancer and early detection, especially in the rural part of people and the people who need it the most, who don't have the means?
So exactly. The thing is that you have already provided a baseline coverage. Now, for us, like the initiatives, has to be that we don't get you the cancer which is stage 3, stage 4, so that even your baseline coverage doesn't suffice that. So we get you the cancer that is stage 2, stage 0, so that this baseline coverage is enough. And that is why this whole initiative. So the best part is that in India, you have now a baseline coverage for everybody who has no means, and who has means can afford. And now who has...
Basically, no one is out of the gambit of the healthcare system. That is something which is really remarkable in that sense, And AI becomes a great enabler to get people to early screening and take the benefit of that policy that has been made by the government.
I'll just give you a small data. If a woman does self-breast, she's able to detect a cancer at stage 2. That 2.53 centimeters lump. So you have to do regular self-breast. Then you go to 6 monthly or 1 year, you go to your gynecologist, physician, ask them a clinical breast by either trained healthcare worker like us or an experienced healthcare worker like Renuka ji. So when they do it, they are able to detect a lump of around 1 centimeter. So basically what you miss, the clinician will catch, and what clinician will miss, the technology will catch. So if this is the amalgamation, and this was the data, which said that if every woman in India starts doing self-breast, we have 60% to 70% of our breast cancer will be at stage 2. So Ayushman Bharat will take care of that.
So before I come to Dr. Sandeep, Mr. Nanda, I would like to ask you, as and when this program progresses and your LLM gets better, algorithms get better, you have more data sets to work with, how does it impact your efficacy and specificity going forward? And how does it make it better?
Of course, more data gives more power to AI, and AI is also built on a trained model, right? And it's a very important and intelligent layer in the system. But I believe the best use of AI is with human, and of course, doctors play a very important role there. So currently, whatever data sets that we have, and we have built that model, it is also been tested and clinically validated. So for example, clinical validations have been done, clinical studies have been done. Those are done in respected hospitals.
For example?
For example, these are done in HCG hospital, in Narayana Hardayalaya Hospital, Max Hospital in Delhi. So these studies are done in comparison with.
Are you available outside India as well as a product?
Yes, these are products are also available outside India in 20
Like
plus
US
countries.
FDA?
Yes, US FDA, the studies are also done outside India, but these studies are done, in comparison with the gold standard. That is very important. For example, every woman walked in, took thermolytics test, then she took mammogram test. And if one of them is positive, then ultrasound. And if ultrasound is positive, then principal investigator, guided for the next line of biopsy. And then the results were compared. And those studies are published. Now that gives, some confidence to the clinical community. I believe a lot of confidence. And then with this kind of coverage that we are doing, of course, more data means more power.
I completely agree with you because I've been part of this journey with you for the last couple of months and I've seen that happen. I think the true problem, and I'll come to Dr. Sandeep with this, is that in India, we need Indian solutions to Indian problems. We cannot look at generic propositions that exist elsewhere in the world. And therefore, we have to understand what are the sensitivities that we are plagued with. At the same time, I think if India truly needs to democratize healthcare and bring it to the rural sector and the people who need it the most, it would be absolutely, imperative that we are in a position to take these technologies to the people and not wait for it to evolve on its own. Dr. Sandeep, what is your take on that?
I think any technology is of no use if it's not used if it's not amongst the use of the people. And secondly, the most important part is that Indianized, if you see the diagnosis of even a cardiac disease is 20 years earlier than what is in the Western population. Same is with any cardiometabolic disease or any disease like cancer also. So we need Indian guidelines, Indian system, Indian, I think more often, the problems which are related to our countries. Sometimes symptoms are different. Indians can behave in a different way than what Western people are behaving. And I think, and technology, I think it needs to be at the lowermost quadrant of the people, because even our Prime Minister also says that you should, if the rural health improves, I think it will uplift.
I mean, the transformation has to happen from rural India.
Country.
Only then can we look towards becoming a developed country.
I just want to add one more thing. Even Indian Medical Association, which I am part of, has adopted this year the theme of Aao Gaon Chale. So I think this is what the utmost important of right now our country is facing, that the rural health should improve. Otherwise, the maximum load or maximum the resources are spent on the health.
So may I ask you, entities, very important entities like the IMA, are you embracing technology? Are you embracing the evolution of technology? Because there's always a circumspect opinion about something that is new and evolutionary, and understandably so. But what is your approach as an organization, as a body, towards the evolution of technology, especially in AI?
Yeah. So, but then, first the idea came because we are living with the community level. So the idea came that we should adopt a village. We should reinforce the idea again and again. And people should go continuously so that more people are educated. But when the technology comes and when it is I think it is US FDA is approving sensitivity of 95% sensitive and 90% specificity, like only 10% chances, which I think no other diagnostic test can match at early. So I think when you have total documentation and everything is when you know the technology is true, I think there's no harm in adopting it. And I think we should move forward. Even I will ask my organization also to move forward in this direction, because ultimately the next generation, the next that next theme will be of the technology in healthcare.
And ironically, I just have this one thing to say, that we also try to stay in, along with the times. And way back in 2018, we had our seminar. We have an annual seminar, basically to bring about awareness on the newer subjects, the newer things that are coming up. And AI was just about coming in at that time. And we had a full load seminar on AI with healthcare and cancer specific.
I think, ma'am, this journey from AI to AGI will be a path-breaking journey and will unlock many value propositions for a country like India and the innovators like Nirmay and other innovators who are actually building solutions for the Indian problem. And I say that because we are akin to our problems and we need to work at our solutions. So I think this is the testament of the new India, the new Bharat that we live in. And we have our problems. We will create solutions for our problems. And those will be created very much in India by Indians for Indians. So thank you very much for being a part of this panel. I'm being told the time is up. So, but I'll definitely, before I part, I would definitely say that, this is something which we have lived through, imbibed through a platform called NXT, which finds alternative and newer technologies, whether they are in healthcare, whether they are in other aspects which touch our lives in different ways and manifest them. And, from concept to execution, this entire program took less than 4.5 months. So, that is the beauty about that. And I think we are now, with the advent of AI and AGI, sitting at the single most important scientific invention since the splitting of the atom. So I hope we can have that kind of positive impact on healthcare and a country of the size of 1.4 billion people. And we have our problems, but we have our solutions as well. Thank you very much. Thank you.
I just want to say that Namo Shakti Rath is adding human touch to the technology. That's